Hi, I'm Karen Sukney with Take 5 Video for Healthcare Packaging. I recently interviewed Dr. Ed Kuffner, Chief Medical Officer at Johnson & Johnson Consumer Health. Throughout his career, including time in the emergency department and poison center, Ed has been really passionate about patient safety, and he's worked with a broad range of internal and external stakeholders to tackle complex public health issues, such as preventing medication errors, accidental unsupervised ingestions in children, misuse, abuse, and overdose. In part one, we discussed the winner of their recent Quickfire Design Challenge and the importance of unit dose packaging, and I'll link to that below. In part two today, we delve into design considerations, including caregiver burnout, as well as some of Dr. Kuffner's tips that we can all heed for helping to prevent accidental unsupervised medication ingestions among children. Let's jump in.
Are there new challenges that you feel are coming up in medication errors? I'm just curious. I know that there's a lot in the news about parent, caregiver, or clinician burnout. People are on their phones a lot. We're all fairly distracted compared to, perhaps 10 or 20 years ago. So I'm curious if that's causing issues that designers should be factoring in, on the positive side of that. Maybe patients are, more educated and knowledgeable. So pros and cons.
Well, you highlight a lot of the considerations that when I look at preventing medication errors or accidental supervised ingestions, I look at it like it's this continuous journey that we're all on together, right? Patients, healthcare professionals, industry, consumer groups, all kind of working together. That's one of the reasons I like being a chief medical officer. That's where I can use my toxicology skills and try to have an impact on public health. For me, it's always, how do you dig deep into what are really the root causes of medication errors and accidental unsupervised ingestions? And the more we understand the root causes, the more that we can design technologies and implement new packaging and new techniques to try to prevent them from happening. And so when I think about that, there's areas where I think we always need to push and dig a little bit deeper. I would say when new products come onto the market, let's understand what's going on with those products. When we start expanding into new categories, it's an opportunity to take a step back and really dig deep again. And do we really understand what's happening? And then when new packaging comes out. And so I think I'll give you a couple examples. The legalization of THC-based products, right? When especially started to formulate them and market them in these appealing food-based forms, right? That's created risks, not just for the users, but for kids when it relates to accidental unsupervised ingestions. I think as categories expand, we're seeing expansion in the area of, say, natural products and supplements. I think there's an opportunity for all of us, right? How do we further refine how these supplements are dosed? Can we put additional measures in place to protect children, like adding dosing devices and child-resistant packaging like we have on more traditional over-the-counter or prescription medicines? Today, I think of things like digital tools, right? I think they have the ability to help make dosing much more accurate, can prevent medication errors. As you said, even how do we better educate patients, consumers, caregivers about these things? So with all these new advances, I mean, I'm optimistic that new technologies, digital solutions, they're really going to help us reduce medication errors and reduce accidental unsupervised ingestions.
Okay, great. Yeah, you bring up a really good point about the supplements, because they have just traditionally been in these, regular HDPE bottles, not necessarily having any child resistance on them. And just because they're over the counter doesn't mean that, they couldn't be dangerous to a kid. So
absolutely, that's where you always got to do a risk-benefit analysis and strike the right balance. Maybe if I could leave you with a couple of tips.
Absolutely.
And so whether you're a packaging engineer, you're a toxicologist, a viewer, a package expert like yourself, I always like to say, hey, at the end of the day, there's information that we can communicate to friends, family, loved ones that help keep all of us, especially kids, safe. And so a couple things I like to say is, make sure you're always reading and following the labeling information on all the products that either you're taking yourself or as a caregiver that you may be given to someone else. This concept of keeping medicines high and out of sight of children is really important. But it's not just important when you're storing those medicines, it's
Mhm.
really important after each and every use. And we know that a big risk area is when caregivers who store medicines high and out of sight appropriately, they take them out because somebody in the family may be sick, they start using them, and they
Mhm.
don't put them back there. And oftentimes that's when kids get into them. Um, Never give adult medicines to kids. There are pediatric medicines and adult medicines, and when you start giving adult medicines to children, we create increased risk. When it comes to especially pediatric liquid medicines, I think it's important to reinforce this concept of always using the dosing device that comes with the product. Don't
Right.
use household spoons. They're notoriously inaccurate. And for people who may put their medicines in purses or handbags or backpacks, and
Right.
then they leave them on the ground and they go to a household or an environment where there may be young kids, it's relatively common for curious young kids, and we want them to be curious, to get into them. And so if you're one of those people who are carrying your medicines around, which many people need to do, really be hyper aware when you're entering new environments where with kids are around. And sometimes you hear from people, even when I was in the emergency department, you'd hear people say, oh, I didn't want to call the poison center. I didn't want to call and bother the healthcare professional. I would say, as healthcare professionals,
Mhm.
we want to hear from patients, right? And
Right.
so if you have a question, if you have a concern, you're unsure, reach out and contact a healthcare professional. We're always here to help. And what I would say is, on top of that, in the United States here, we have an unbelievable poison center system. And the poison centers are open 24/7. They have healthcare professionals on the ready to help you. So if you ever have any questions about yourself or someone you're caring for, call the
Mhm.
poison center. They can give fantastic advice and they're happy to do it.
Okay, great. Yeah, those are good tips. I mean, we are all ultimately responsible for, the health of people around us in terms of at least not exposing children to packages that they shouldn't be around. So that
Absolutely. But thank you so much. Very enjoyable talking with you, and I really appreciate it.
likewise. Thank you so much, and hope you have a great rest of your day.
You too.